Historically, Latino immigrants have faced considerable barriers to accessing health services such as HIV testing, and this is true for many immigrant groups. So my broader program of research focuses on the unique role of migration in shaping sexual and reproductive health disparities. However, the role of migration in shaping health outcomes has been sorely overlooked in the health disparity literature. And this is a critical gap given that the immigrant population in the United States is rapidly growing and migration and mobility is more feasible and accessible than ever. So rather than advancing broad-based frameworks about the relationship between mobility and health, I'm looking at developing more specific frameworks that integrate unique determinants to really identify strategies that can address specific sexual reproductive health outcomes such as HIV infection. Over half of Latinos in the United States have never been tested for HIV, and when they do test, they're more likely to get tested further along in their disease progression. And this is critical given that Latinos are disproportionately impacted by HIV infection. And what interests me in my research is that Latinos currently comprise the largest foreign-born population in the United States. So I'm really interested in how migration might play a role in HIV testing behaviors. My dissertation project focuses on HIV testing among Latino immigrants in New York City, and I'm specifically looking at the community of Corona, Queens, which has an incredibly large foreign-born population in New York City. And I'm looking at specifically perceived access to HIV testing behaviors, along with how specific factors in immigrants' migration process might influence their likelihood to get tested for HIV. And this project is incredibly timely given current shifts in the healthcare context with major policy changes. So my study is looking at whether macro-level shifts in our healthcare context can shape individual-level decision-making behaviors. Throughout my doctoral training at New York University, I worked as a predoctoral research scientist at the Center for Latino Adolescent and Family Health, and I've worked closely with my primary mentor, Dr. Vincent Guillermo Ramos. And through this work, I've been able to engage in all phases of the research process, from developing grant proposals to collecting the data, analyzing the data, and disseminating the research findings. Through this experience and this work opportunity, I've been able to hone my research skills and my critical thinking skills, and I feel well prepared and positioned to be a leading scholar and an independent researcher. My overall goal is to build upon my current work and to develop prevention interventions that address sexual reproductive health disparities among this growing and vulnerable immigrant population in the United States and abroad. And I hope to accomplish this by integrating research, scholarship, and teaching at a research-focused academic institution.